Friends, today I'm going to talk about the HbA1c test in diabetes. HbA1c is a very commonly ordered test in diabetes care. It's a simple test because it does not require fasting. The other good thing about the test is that it gives you an idea of the long-term glucose control. A single blood test gives you a 3-month average of the blood glucose levels. The third point is that it is associated with diabetes-related complications. But what is HbA1c? HbA1c is glycosylated hemoglobin. We know that we have some cells in the body called red blood cells, and that within the red blood cells, we have hemoglobin, and hemoglobin takes oxygen to the cells and takes us to health because it gives us energy. Now, glucose binds to proteins like hemoglobin, and we can actually measure the quantity of the glycated or glucose-bound proteins like glycated hemoglobin, and this quantity can be measured. Now, this single measure of HbA1c gives us a 3-month average of blood glucose levels. The question is how? As I said, red blood cells live in our body, and hemoglobin lives in red blood cells, and that glycated hemoglobin also, therefore, is in the red blood cells. And red blood cells have a life of 3 months, and therefore, the hemoglobin A1c test gives you a 3-month average of blood glucose levels. It's a very simple test. It doesn't require fasting, and it's very importantly because it binds to proteins like the very fact that glucose binds to hemoglobin is an indicator that it might bind to other proteins in the body and damage them. So it correlates. A high HbA1c does not only reflect glucose control, it also predicts the glucose-related complications of diabetes, such as diabetic kidney disease, diabetes-related eye disease, diabetes-related foot disease, and diabetes-related increase in the risk of, say, heart attacks or stroke. Usually, the HbA1c test correlates very well with the blood glucose levels. But occasionally, we will find that our patient's HbA1c is high, but on the day of testing or sometimes on the day of visiting the doctor, their blood glucose levels are okay. And the reason is given in this picture because you can see the last 3 months, the patient may have not exercised or eaten. I've just put some pictures of cakes and pastries, but on the day of testing, the patient may have followed a good diet. So that's not okay. That tells us that though the blood glucose level on the day of testing is normal, if the HbA1c is high, that's not okay. On the other hand, sometimes the patient will say, "Doctor, my blood glucose level is high, but my HbA1c is good." That means the HbA1c is good. That means for the last 3 months, the person has been following diet, exercise, and everything regularly. And maybe on the day of testing, he or she has taken a pastry. And that's why there is a temporary increase in blood glucose levels, and that's okay. Of course, there are many other reasons for a change in HbA1c, like, for example, anemia, genetic abnormalities in hemoglobin, kidney failure. For all that, you'll have to consult a doctor. But in general, I want to say that HbA1c is a good test, not just to detect high glucose, it can also diagnose diabetes. HbA1c of below 5.7 is considered normal. HbA1c of 5.7 to 6.4 is considered pre-diabetes, a disease where there is high blood glucose levels, but not high enough to be called diabetes. People with pre-diabetes can follow diet and exercise and prevent diabetes. And if the HbA1c is more than 6.5, that suggests that the 3-month average is high and that the person has diabetes. Now, if you do have diabetes, what is a good HbA1c to have? In general, the diabetes associations across the world say that HbA1c of below 7% is good. But HbA1c goals today are more personalized. For example, somebody who's young, relatively in good health, we might like to keep that HbA1c below 6.5%. Somebody who is 70 or 80 with diabetes-related complications, whom aggressive control of HbA1c can be associated with low glucose, we might like to keep the HbA1c at 7.5% or higher. But as I said, keeping the HbA1c below 7% is considered good for most people. So that's it, folks, about HbA1c. It has been a pleasure discussing this topic with you, and thank you so much for listening to me.